Hey guys, I'm going to skip the intro on this one and get straight into it. So there's a difference between being close with your family and being enmeshed with your family. Enmeshment involves blurred or non-existent boundaries, unhealthy family patterns, control, social problems, or a dysfunctional relationship pattern, and a lack of independence and individuality. In enmeshed relationships, which can sometimes be disguised as being close, there is no respect for individuality. The enmeshment creates family dynamics where there's control and where there's a lot of guilt and shame, and individuals are or can be punished or criticized for their authenticity or their individuality. Many families fail to implement healthy boundaries, leading to a lot of enmeshment and deep emotional pain. Enmeshment is most common between parents and their children, though it can also occur between couples and entire families. A healthy family is one where the parents are supportive and sets clear guidelines to help raise and protect their children. Children, in turn, grow up and learn a lot about themselves and the world. They gain independence and develop personal boundaries. Healthy families show respect and love for each other in the household. On the other hand, one of the biggest enmeshment family signs is being too involved with each other's lives, to the point almost of being controlling and invasive. Children of enmeshed families often lack their own sense of identity and have a difficult time becoming independent or autonomous. A common enmeshment family sign is that children feel overly responsible for their parents' needs, dreams, or feelings, or vice versa. So enmeshment can be a very tricky thing to identify, especially by the people that are trapped in the family dynamic. Where substance abuse is concerned, enmeshment can become especially entrenched in a family dynamic. I often see children fail to become independent and leave the family home. This might be because the parents wanted so badly to control the person and their addiction that they removed the possibility for the person to go out and experience any version of independence and self-reliance. It may have felt safer or needed for the parents to just entirely protect the child from themselves, at least in the mind of the parents. The thinking could be something along the lines of, well, I would prefer to have them under my control where I know where they are and what they're doing versus being out on the streets. By doing this, the parents essentially could have robbed their child of the potential to experience any of the consequences of their behavior, whether those consequences be good or bad, which is essential for learning and development. This is an extreme example, but there are other ways that family members might engage with each other that create similar scenarios. So addiction can be a catalyst for creating these dynamics, or these dynamics can be a catalyst for addiction or substance abuse. Either way, the dynamic becomes incredibly toxic for everyone involved. Even where substance abuse isn't involved, enmeshment is incredibly unhealthy for all parties concerned. Having a few enmeshed family signs does not necessarily mean that your home life is or was toxic, but it is always best to grow away from codependency or situations that make you feel disrespected. You can stop the enmeshed family pattern by rediscovering who you are and setting healthy boundaries with family members. Therapy can be an amazing tool for reevaluating enmeshed relationships and getting to the root of any attachment issues that you might be dealing with. This may mean having to limit contact or ultimately cutting contact with somebody. I often have it that parents of adult children who are addicted come into my office and make demands in terms of what the rehab or therapy process should look like. I've had parents insisting that I facilitate the breakup of a marriage or relationship despite this being contrary to what my patient might want or need. It's important to take note that a psychologist's role is not always to only facilitate the request of family members, but to rather work through the issues that the patient might bring to the table or that the treatment team deems essential. If there are unhealthy things going on, it's more than likely that the issues will be discussed and explored in the therapy sessions. Helping a patient make informed decisions based on their personal process is important for having an authentic buy-in by the patient for when the time comes to execute on challenging issues. Having said that, it's important to remember that family members could also consider going through their own therapeutic process so that they can explore their own challenges and perhaps become aware of toxic family dynamics. Thanks for watching, everyone. Looking forward to seeing you soon again.